Okay, welcome to today's Explainer. We are diving straight into the world's leading causes of death. And honestly, there's a completely stunning truth hiding in the data here. Premature mortality is surprisingly preventable, solvable, and quite frankly, predictable. I mean, so often we view severe illness and death as these random, unavoidable lightning strikes, right? But once we really dig into the numbers, you start to realize that the vast majority of what ends human life, well, it isn't much of a mystery at all. In fact, humanity has already solved the medical science for most of it. So, why are millions still dying? Let's get into it.
To get to the bottom of this, our agenda today covers the predictability of death, diseases of daily habits, the silent internal assassins, tragedies of unequal access, and finally, sudden and behavioral risks.
Kicking things off with Section 1, the predictability of death, recognizing the scale.
Just look at the sheer macroscopic scale we're dealing with here. Heart disease claims a staggering 9 million lives every single year. That's more than any other cause by a long shot. Strokes take another 6 million, and chronic obstructive pulmonary disease, or COPD, takes 3.2 million. The wild part? Most people dying from heart disease actually had warning signs for years, sometimes even decades before the fatal event. Things like high blood pressure, high cholesterol, a lack of exercise. Doctors can literally see this coming from a mile away.
Zooming in on the biology of our second leading killer, a stroke essentially happens when the blood flow to part of your brain just stops. Either a clot blocks an artery or a vessel bursts. And when that happens, brain cells or neurons start dying off within minutes. But what's absolutely crucial to understand here is that preventing a stroke overlaps heavily with preventing heart disease. Controlling your blood pressure is literally the single biggest risk factor you can manage, along with stopping smoking and keeping diabetes in check. The truly terrifying part, though, is kind of the randomness of the outcome. You could have two people suffer nearly identical strokes, one recovers fully, while the other completely loses the ability to speak forever.
Because time is literally brain tissue. Notice the direct, actionable steps mapped out here for when those biological emergencies happen. Recognizing these signs, a face drooping on one side, arm weakness, maybe slurred speech, is an absolute race against time. We actually have treatments that can dissolve clots, but they only work within a super narrow time window. Every single minute of delay costs neurons. So, if you see these signs, you call emergency services immediately. No hesitation.
Moving right along to Section 2, diseases of daily habits, the cost of repetition.
Take a look at the stark reality of COPD, which is essentially a slow suffocation that takes decades to develop. Notice that massive blue section? 80 to 90% of COPD cases and roughly 85% of lung cancer cases trace directly back to one specific individual choice: cigarette smoke. Cigarettes contain dozens of carcinogens that directly damage your lung cell DNA. The rule here is incredibly simple and, frankly, brutal. More cigarettes plus more years smoking equals a drastically higher risk. If you smoke, COPD is probably already starting to destroy the tiny air sacs in your lungs.
Similarly, let's look at type 2 diabetes. This kills 1.5 million people directly each year, and millions more from complications. Look, our human bodies just weren't designed for constant sugar intake and completely sedentary living. When you overwhelm your system with decades of excess glucose, the system basically breaks. But notice this prevention loop. We can actually prevent or even reverse it early on through weight loss, regular exercise, and just dropping those processed carbohydrates. It's a disease totally driven by daily habits, meaning the power to stop it, it's entirely in your hands.
And hey, taking control of your health really requires good information, right? If you want to actively research your own symptoms or maybe deeply understand the new diagnosis, the source material points out an incredibly useful AI tool called chatllm.abacus.ai. It actually bundles all the top AI models. We're talking GPT-4, Gemini Pro, and Claude Opus into one interface for just $10 a month. It has this Route LLM feature that automatically picks the absolute smartest model for your specific health question, which makes it an amazing resource to keep yourself informed and empowered about the very conditions we're talking about today.
All right, Section 3, the silent internal assassins, threats without warning.
This number here is just terrifying, 70%. A person can lose a massive 70% of their kidney function before feeling any symptoms at all. Your kidneys are designed to filter waste from your blood, but as they fail, those toxins just silently accumulate. There is absolutely no pain as this function declines. It's silently poisoning the body until the damage is completely irreversible, and suddenly you're facing dialysis or a transplant.
Which, of course, brings up a super critical question. If these internal assassins operate entirely without pain or immediate symptoms, how exactly do we stop what we literally cannot feel? We can't exactly rely on our bodies to sound the alarm bell here.
Well, the solution relies entirely on proactive hunting. You really have to go looking for it. This means utilizing regular blood tests to catch that declining function early on. It also means carefully managing high blood pressure and diabetes, which, by the way, cause the vast majority of kidney disease. And here's a surprising fact from the source. You really must avoid chronic overuse of everyday painkillers like ibuprofen, which can severely damage your kidneys over time. Prevention here means avoiding the fate long before the trap ever springs.
Let's transition over to Section 4, Tragedies of Unequal Access, Geography as Destiny.
Notice the really stark contrast here. On the left, we've got individual prevention, reversing diabetes through diet, or avoiding COPD by simply not smoking. But on the right, we have systemic prevention. Diarrheal diseases kill 1.5 million people annually, mostly children, in places without clean water. Severe dehydration can turn fatal within a matter of hours. Preventing this doesn't require advanced futuristic technology. It just requires basic systemic infrastructure like clean water supplies and sewage treatment. In wealthy countries, these deaths are highly exceptional, but in impoverished ones, they're a daily tragedy.
Look at this timeline for tuberculosis. It's an ancient disease, but it still kills 1.3 million people every single year. TB bacteria can actually lie completely dormant in the lungs for years. But once it activates, causing severe weight loss and night sweats, curing it requires a rigorous, strictly adhered to 6-month antibiotic course. I mean, imagine trying to complete a 6-month medical regimen in an impoverished region with barely any healthcare access. It's incredibly difficult. And when patients inevitably can't finish the course, it breeds these devastating drug-resistant strains of the disease.
So, the absolutely crucial point here is that we are not waiting on scientific miracles for these global threats. Just look at this list. We know exactly how to suppress HIV with antiretrovirals. We know how to cure TB with antibiotics. We know how to prevent malaria with cheap, insecticide-treated bed nets and new vaccines. Yet, millions still die simply because they were born in a place where these cheap, proven resources just cannot reach them. The solutions exist, guys. The implementation is the actual problem.
Which brings us to our final part, Section 5, Sudden and Behavioral Risks, the Preventable Tragedies.
1.2 million people die in road accidents every single year. Most of them are young, and the investigations predictably follow the exact same patterns in almost every single crash. Speed kills, alcohol impairs, distraction from phones completely destroys reaction time. Meanwhile, basic tools like seatbelts and helmets save lives. It's frustrating because we know exactly what kills people on roads, we just keep doing it. Countries that actually implement strict road designs and safety enforcement see these deaths drop significantly.
We also have to address the 700,000 annual lives lost to suicide. This generally results from pain exceeding a person's coping resources at a given moment. But the truly crucial point here is that the permanence of the solution vastly exceeds the permanence of the problem. Depression is highly treatable. By reducing access to lethal methods during a mental health crisis, we create vital time for that temporary impulse to pass. In fact, most survivors of attempts report immediate regret. Access to mental health care and just removing the stigma of asking for help literally saves lives.
As we wrap up this explainer, this overarching quote from our source material just perfectly summarizes the illusion of inevitability. The medical problem is solved. The access problem persists. For so many of these massive, terrifying killers, from HIV to diarrheal diseases to tuberculosis, humanity has already solved the underlying medical science. It's systemic inequality and a complete lack of access to basic resources that allows the deaths to continue at such a massive, macroscopic scale.
Which leaves us with a dual challenge. Knowing that premature death is largely preventable, solvable, and predictable, we have to ask ourselves, will we accept a world where child survival depends entirely on where they happen to be born? And on a more personal level, looking at those diseases of daily habits we discussed earlier, what is one habit you will change today to rewrite your own health narrative? The knowledge is out there. The tools are right in your hands. How are you going to use them?